Do you know how crucial your liver is for your overall health? Your liver, about the size of a football, is an essential organ that keeps you healthy. Throughout the day, it works hard to clean your blood, help with digestion, and give you energy. Your liver is also responsible for dealing with medications. However, some medicines can harm your liver, causing drug-induced liver injury. Unlike kidneys that can be helped and treated with alternatives, a failing liver often has no backup plan. Over 2,000 cases of liver failure each year in the U.S., with half linked to medications, emphasize the importance of understanding these risks. By knowing about the risks, you can make better choices to keep your liver healthy. Join us as we discuss the effects of medications on your liver and share tips for a healthier future. What's the main job of your liver? Well, it's like your body's purifier. It filters out all sorts of stuff: alcohol, medications, drugs, even the chemicals you experience without knowing. The liver processes these things and gets rid of the waste through bile and urine. However, some stuff can be harmful to your liver. What are the early signs and symptoms of liver damage you should know? Early signs and symptoms of liver damage from medications include stomach pain, fever, diarrhea, nausea, vomiting, dark urine, white-colored stool, yellow skin and eyes, severe fatigue, itching, and skin irritation. The time it takes for medication to harm the liver varies from person to person and depends on factors like dosage, age, existing liver issues, or substance use. Symptoms typically appear 5 days to 3 months after starting treatment. Remember, alcohol and certain drugs like cocaine can also harm the liver. If a doctor prescribes your medication, don't stop it without consulting them. Now let's talk about the top 10 medications that can destroy your liver, with the most important one at the end, so stay tuned until the end. Number 1. Methyldopa. Methyldopa is a medicine commonly used for high blood pressure, known for being safe, and it's often recommended, especially for pregnant women dealing with hypertension. However, despite its usual safety, there's a possible connection between methyldopa and liver issues. So, if you already have liver problems like fibrosis or cirrhosis, it might not be the best fit. It's important to be aware that trouble with the liver could show up within about 12 weeks after starting methyldopa. Regular checkups are essential for folks using this medicine to catch any early signs of liver problems. This care is vital to prevent things from getting worse and to make sure that treating high blood pressure doesn't put extra strain on the liver. Number 2. Methotrexate. Methotrexate is a common medication used for conditions like rheumatoid arthritis and certain cancers. It's important to keep an eye on liver enzymes because this medicine can sometimes cause liver issues, ranging from minor to serious. Doctors routinely check these enzymes in methotrexate users to catch any liver trouble early. If there are signs of damage, they can adjust the medication or treatment plan to avoid major problems. Following the doctor's guidance on how much and how often to take methotrexate is crucial to lower the chances of side effects, especially potential harm to the liver. Depending on how well a patient is responding, doctors might explore different treatment options to reduce the risk of liver issues. Number 3. Diclofenac. Diclofenac, a type of anti-inflammatory medicine, similar to ibuprofen and naproxen, has a rare but higher chance of causing liver damage compared to others. Unlike its counterparts, diclofenac stands out for its potential to harm the liver, and these issues might show up weeks or months after you start taking it. It's not just about the kidneys. Diclofenac can affect the liver too. Although liver problems from anti-inflammatories are uncommon, it's crucial to stay alert to any unusual symptoms. If you are finding this video helpful, please consider subscribing to this channel for more amazing health videos. Always keep in mind that diclofenac isn't limited to medications only. You'll find it in gels, creams, and patches meant for your skin. The good news is that when you use these topicals, the risk of causing trouble for your liver is lower. That's because only a tiny bit actually gets into your body through your skin. If you notice anything concerning, it's best to talk to a healthcare professional promptly. Understanding the specific risks of diclofenac helps you take proactive steps to look out for your liver and kidney health. Number 4. Amiodarone. Amiodarone, a medication commonly used by heart doctors for irregular heartbeats, does a good job of improving heart rhythm, even showing positive results in day-long heart monitoring. But it's important to know that amiodarone comes with a risk of side effects, affecting the thyroid, lungs, skin, and yes, the liver too. Due to these potential issues, Doctors are cautious and prescribe it selectively, mainly when the benefits outweigh possible risks. Generally, amiodarone doesn't immediately harm the liver. It takes a few weeks to months for any adverse effects to become apparent. Number 5. Allopurinol. Allopurinol is a medication often given to folks with high uric acid or dealing with gout when dietary changes don't do the trick. This medicine does a good job of lowering uric acid levels, preventing those painful gout attacks. But it's important to know that allopurinol can affect the liver, and liver issues linked to it can pop up quite quickly, sometimes within days or weeks of starting treatment. So, it's super important to keep a close watch on people starting allopurinol, checking for any signs of liver trouble. Regular checkups are like a safety net, helping catch and adjust treatment if any problems show up. If someone noticed anything strange while using allopurinol, they should give their doctor a heads up right away. Despite these risks, allopurinol remains a helpful choice for many dealing with gout or high uric acid levels. Number 6. Amoxicillin with clavulanate. Amoxicillin combined with clavulanate, a commonly prescribed antibiotic for infections like sinusitis and pneumonia, works well but has a concerning issue. It's been linked to cases of sudden liver damage, a serious condition causing quick harm to the liver. Recognizing this possible risk is crucial when prescribing or using this combination. Doctors need to closely watch patients, especially those taking it for a long time or in high doses. It's crucial for patients to quickly seek medical help if they notice signs like yellow skin, dark urine, extreme tiredness, nausea, vomiting, or belly pain, as these could mean possible liver problems. Number 7. Anticonvulsants. Seizure medications such as phenytoin, known as hydantoin, and valproic acid, depakine, have the potential to harm the liver. Hydantoin can start causing liver issues soon after you begin taking it. On the other hand, the effects of depakine may appear between 1 to 6 weeks into the treatment. That's why it's important to regularly check liver enzymes. Additionally, carbamazepine and lamotrigine can also, although rarely, lead to liver injuries. Number 8. Antipsychotics. Risperidone and copain are medications primarily used for treating psychosis. Interestingly, they're also applied in cases of severe depression that don't respond to usual treatments. These drugs, however, carry a potential risk of causing liver damage, mainly through a process called drug-induced cholestasis. This happens when medications like risperidone and quetiapine disrupt the normal flow of bile from the liver. Bile is essential for digesting fats and getting rid of certain waste from the body. If these drugs interfere with this process, it can lead to a buildup of bile in the liver, which might cause harm. That's why it's crucial to keep a watchful eye on individuals using these medications, paying attention to any signs of potential liver issues. If you've watched until here, drop a comment sharing your thoughts on how these medications have impacted your life. Let us know if you've watched the video until now. Number 9. Antifungals. Certain antifungal medications like fluconazole and itraconazole work well against issues like nail infections and candidiasis. However, in some folks, especially those with a tendency for liver problems, these medicines might pose a potential risk to the liver. If you're using them, keep an eye out for any signs of trouble with your liver. Now, there's another medicine called methyldopa. It's often given to people dealing with high blood pressure and is generally seen as safe, even for pregnant women. However, despite its usual safety, methyldopa has been linked to possible liver issues. So, if you already have liver troubles, it's better to avoid this one. Liver concerns from methyldopa might show up within about 12 weeks, so regular checks are important to catch any early signs of liver problems. This careful approach is key to preventing any complications and making sure that treating high blood pressure doesn't harm your liver. Number 10. Paracetamol. Paracetamol, commonly used for pain and fever, can lead to severe liver issues if not used properly. While it's generally safe when taken as recommended, some individuals misuse it by exceeding the suggested dose. This misuse can result in acute liver failure, a serious condition that may require a liver transplant. Various factors like alcohol, genetics, and other medications can heighten the risk of liver damage from paracetamol. Symptoms usually start a few days after taking too much. There is an antidote, acetylcysteine, but if you surpass the recommended dose, Seeking emergency help is crucial to avoid potential liver transplant needs. Remember, not all medications harmful to the liver are listed, so utmost caution is essential. Severe cases, known as fulminant hepatitis, can be life-threatening, with only a small percentage surviving without a liver transplant. To keep your liver safe, treat all medications super carefully. We appreciate your support, and don't forget to check out this video. If you like this video and want more informative content, hit the like and subscribe button below. Feel free to drop a comment if you have any questions or insights to share.